Hey guys, this is Dr. Hub. Today we'll look at the disturbances, and these disturbances are the body fluids. So to begin with, first is the type. So we look at the isometric volume contraction, osmotic volume contraction. So what is the example here? Example will be the diarrhea. And how is the ECF volume? The ECF, if you see, it is going to be decreased. Then we look at the ICF. ICF, there has no change, so there is no change. Then when we look at the osmolarity, it will also be there is no change. It is normal and there is no change. Then comes the hematocrit. In terms of the hematocrit, it is slightly increased, and the plasma protein is also increased. Next, we look at the hyperosmotic volume contraction. So we look at the hyperosmotic volume contraction. So here there is the examples being, there is sweating, there can be presence of fever, as well as the diabetes insipidus. So how is the ECF volume here? The ECF is going to be reduced, as well as the ICF is also going to be reduced. Then comes a question on the how is the osmolarity. Osmolarity is increased. Then if you look at the hematocrit, there is no change. There is no change. Then what about the plasma proteins? Plasma protein is going to be increased. Then we move on to the hypoosmotic volume contraction. So hypoosmotic volume contraction. So under hyperosmotic volume contraction, the example is the adrenal insufficiency. There is adrenal insufficiency. Then how is the ECF? The ECF is going to be reduced. Then the ICF will be increased. Next, when you look at the osmolarity, so the osmolarity, it will be decreased. Then the hematocrit is going to be increased. Then what about the plasma protein? Plasma protein is going to be increased. Next, we look at the isoosmotic volume expansion. So in terms of the isoosmotic volume expansion, so here what is the example? The example is the infusion, and this is of the isotonic NaCl. Then comes the presence of ECF. The ECF volume, it is increased. Then comes the ICF, there is no change. And when you look at the osmolarity, there is no change. Next, in terms of the hematocrit is decreased. Then when you look at the plasma proteins, plasma protein is decreased. Next, we look at the hyperosmotic volume expansion. So in terms of the hyperosmotic volume expansion, so here what is the example? The example is nothing but the high NaCl. So there is a high NaCl intake. And then comes a question on the ECF. So ECF is increased. Then what about the ICF? The ICF is decreased. Next, looking at the osmolarity. The osmolarity will be increased. And looking at the hematocrit will be decreased, as well as the plasma proteins is decreased. Then we move on to the hypoosmotic volume expansion. So in terms of the hypoosmotic volume expansion, here the example is nothing but the SiADH. Then when we look at the ECF volume, and the ICF volume, both are increasing. And looking at the osmolarity, it remains decreased. Then the hematocrit also, there is no change in hematocrit. Then when you look at the plasma proteins, it is decreased.